My topic of today is Robotic GI Surgery. I am Dr. Mandeep Kaur from Indraprasth Apollo Hospital. I am associated with Dr. Arun Prasad for last 3 years. So, let me start my presentation with a question. Can anybody think of a machine which one has to control with 4 controls with hands and 3 controls with the foot, and at the same time you're looking around and chatting with each other? Will you be comfortable controlling this machine? I'm talking about a car. Everybody drives around, 3 controls in foot, controls in hand. We're talking and at the same time looking at direction, and nobody is bothered about, nobody's actually practically thinking about the driving. So how do I relate these 2 slides to my presentation today? Let's talk about the stages of surgery. Surgery began with open surgical technique where there was a lot of pain, muscle cutting, a lot of blood, longer recovery periods. And from this open surgery, there was a big leap to the laparoscopic surgery. After the initial few hitches with laparoscopic surgery, the open surgical people getting used to laparoscopic surgery, the laparoscopic surgery offered great advantage over the open surgery. But just now, as Dr. Pradeep mentioned, that there is a problem with laparoscopic surgery. The assistant is, you have to depend totally on your assistant for camera. And then there is difficulty manipulating the instruments, 2 straight hard instruments without the movement of the wrist, without the tactile feedback. The surgeon has to keep manipulating these instruments. And then there is impaired visual perception. And it is also not adapted to complex procedures. People who are doing laparoscopic surgery for long time may be able to do laparoscopic procedures. The learning curve is really steep in laparoscopic surgery. And also there is limited instrument movement. And as I mentioned, that there is dependence on assistant for vision. And then the surgeon is, actually thinking, wish I had 4 arms. So somebody grasped the idea of having 4 arms. Intuitive Surgical, they made the robotic WALS system. We at Apollo have WALS SI system. It is like driving the car. Now I come back to my previous slides where I talked about 4 hands. There are 3 instrument arms. There is 1 telescopic arm, so there are 4 hands which surgeon actually has and is operating. The second part is the patient card, which is the 2D monitor with the energy source and everything incorporated in 1 card. This is for the surgeon on the patient side. And the third is the surgeon's console. I'll be talking about the various parts in detail. Let's go through this short video of how the robotic surgery actually is done. We at Indraprasth Apollo Hospital are doing various robotic procedures in urology, gynecology, urogynecology, general surgery. Even the pediatric surgeons are doing robotic surgery. And in this video, we're talking about the various arms of the robot. You can see that the movement at the wrist of the instrument, it is 360-degree movement. Even the human wrist doesn't have as many degrees of freedom as the robotic wrist has. It has 7 degrees of freedom. It can move in all the directions. Here, this is Dr. Arun Prasad. He is operating sitting on the console. These are the foot controls. This one is for the camera. This one is for releasing all the instruments when you are out of focus. These are the energy channels. So the patient is anesthetized. The card is prepared, and the robot is brought to the patient. Now, for our convenience, what we have done is we have made the terms like upper GI position or the lower GI position. This is how we go about it. We just tell them that this is what we're going to do. We need lower GI position, and the OT technician knows where to place the robot. And it has come after 3 years of working with a dedicated team. So that the central one is I'm sorry, I don't have a pointer. The central one is the camera arm, and these 3 are the rest other are the instrument arms. These are the external views of the surgery. where the robot is operating and the surgeon is sitting on the console. These two finger loops are like small mouse sticks. If somebody has played video games, in fact, playing video games with my child has helped me learn robotic surgery very nicely. I started doing robotic surgery along with Dr. Arun Prasad. We started at the same time. He is an eminent laparoscopic surgeon and does laparoscopic surgeries perfectly. But for me, I was learning laparoscopic surgery with him, and then later I realized when he started doing robotic surgery that learning robotic was much easier than learning laparoscopic surgery. So this is again a small overview of the robotic suite, where you have the anesthetic robot, as we call it, the anesthetic machine. Our machine, this is an upper GI procedure that we are doing here. Now when you say this term robotic surgery, many of my patients, they come up with this question. See, who is operating? If it is the robot who is operating, why should I pay you? So this is what I explained to the patient, that currently the robot does not have an autonomous software to make decisions. It is the surgeon who is operating. I am the boss. Robot currently is a master-slave relationship with the robot. And at the same time, the next question is, if it is you who's going to operate, why should I pay extra for the robot? Because after all, it's an expensive surgery. So these are the advantages, and there is a long list of advantages which I'm going to go through. It is less invasive procedure. The robotic arms are much easier to use. As the robotic arms, the robot has a shoulder, an elbow, and a wrist, and 7 degrees of freedom at wrist. It's much easier as compared to laparoscopic instruments. There is the dissection. I'm going to show a small video on the precision of the dissection and suturing. Suturing is one area which robotic surgery has made really easy. For the laparoscopic surgeons who are doing surgery for long, the laparoscopic suturing is one thing they boast about, that they're doing laparoscopic suturing very efficiently. So with the robo, you can actually have the real movements of the wrist, forehand, backhand, and the upper and the lower equally efficiently. In fact, better efficiency than the open procedures with human wrist. So this is a very short video demonstrating about the suturing. Suturing has become a cakewalk with robo. You can see the efficiency with which the arm is actually turning and twisting around. And it also filters the hand tremors, and the movements which actually decrease the precision of surgery when we're talking about laparoscopic surgery. Is the time up? Okay, I'll wind up. So, in laparoscopic surgery, the hand tremors are magnified. It is exact reverse in the robotic surgery. The hand tremors are filtered. All right, we all know, I've talked about the shoulder, elbow, and the 360 degrees of freedom. The control of the 4 robotic arms, it makes the coordination easier, and it's less tiring for the surgeon. This is again a short video on dissection where I want to demonstrate, this view is not possible in laparoscopic surgery. Look at the arms of the robot, which are moving at an angle without even you realizing that it actually is moving at an angle. While at the same time, the harmonic, which is also robotic, does not have the wrist. Working with harmonic, you feel it's difficult to work with the harmonic. I'll go through it quickly. Then the 3D vision, of course, we know that's a benefit. Okay, this is the surgeon's console with the goggles are here. This is the these are the loops for the surgeon to operate. This is the hand desk, which is like the latest Mercedes. It can move up and down, and you can control it according to yourself. And these are the foot pedals. It has the same function. It can move in front, and you can adjust it according to yourself. Alright, these are the slides which are just going to demonstrate the details of then the various scopes of robotic surgery, robotic gastrointestinal surgery, bariatric surgery. This is the forte which we stick to. Thoracic surgery, there's a lot of thoracic surgery that we are doing. This is a short video of super obese patient. This patient was had BMI of 60. We did a bypass surgery on this patient with the robo. After having done so many laparoscopic surgeries on super obese patients and obese patients, we were very happy to see results in these patients. Patient was up and about on his foot, walking up to the loo 6 hours after the surgery, the same day. That is post-op patient. As I mentioned, 6 hours after the surgery, patient was up and about. Then there are various other and more important photos, in fact, for robotic surgery are urology and gynecology. Cardiac surgery, head and neck surgery is also seeing some use of robotic surgery. Disadvantages being the cost. It is very expensive for the patient. Hospitals, they are having a very hard time recovering the cost. So it is limited just to major tertiary care centers. And the cost benefit is not in favor. But at the same time, when we talk about the mobile phone, when it was launched in 1997, the call was 14 rupees per minute. And imagine now the most benefited person from the mobile phone is the vegetable seller of my colony. So the future perspectives in robotic surgery, we're talking about single incision surgery, single incision robotic cholecystectomy. It is already been done. Then there is Firefly. Okay, this is the almost the last time. Okay, there's a Firefly which is again a very good invention in robotic surgery. And then summary, by providing surgeons with superior visualization, there is enhanced dexterity, greater precision, ergonomic comfort. Surgical robot has made it possible for more surgeons to perform these complex surgeries, rather than few higher-end laparoscopic surgeons only doing these complex surgeries. Okay, with this I will conclude. Can be done is not same as must be done. That is it. Thank you.
Thank you, Dr. Kaur. I think we have question answer session that we